Chris Walker, Emergency Preparedness Coordinator with the Hamilton County Health Department, joins us again. Hello.
Good morning, ma'am.
Bring us up to date. It's been a nice long Thanksgiving holiday weekend, but our numbers are not going where we would like to see them go.
Yeah, no, we were heading into the Thanksgiving weekend with some rather high numbers. Our county advisory level was elevated back up to orange. Not really where we wanted to be, knowing that people are going to be traveling a lot. We expect to see some high numbers as we move through the week and people return from Thanksgiving travel and things like that as well. So hang on, it's probably going to be a rough ride the next few weeks.
Speaking of which, let's talk about the new variant that was making headlines over the weekend, Omicron. Some are saying it could be far more contagious than even the Delta variant. What do we know? What advice do you have for folks?
The big thing is that it obviously it's new. We've seen a lot of different variants throughout the last 2 years. Sit tight. It's not time to hit the panic button, but we need to be paying attention. We need to double down on our good hand hygiene, our social distancing, and things like that. The other thing that we've not talked about too much is we're seeing much higher rates of influenza this season, specifically the H3N2 influenza A virus. So, we're basically tackling two different viruses at the same time, which is causing, difficulties throughout the healthcare system and everything else. So, good reason to go get your flu shot if you haven't. Good reason to go get your COVID vaccine if you haven't already. And, if you're eligible, which basically everyone 18 and over is now, go get your booster if you're within that or beyond your 6-month window from your second shot.
What kind of response are we seeing out at the 4-H fairgrounds right now? I know it's walk-in if you're 12 and older, registration only for kids. Are we still seeing a pretty good turnout?
Yeah, it's pretty steady out there. High demand for the kids. We're working on putting on some more staffing to be able to offer some more evening hours and things of that nature to help to get the kiddos vaccinated. But shouldn't be too big of an issue as far as being 18 and over, 12 and over to get your first, second, or third doses at this point, booster dose at this point.
Tomorrow night, we're going to be hosting a virtual town hall at 6:30 to discuss kids and the COVID vaccines, specifically kids 5 to 11 years old. And you and I have been working with pediatricians and infectious disease experts here in Hamilton County. They're going to be joining us to give us their take. I don't know about you, but I've actually been surprised to learn just how many kids in our area have been really sick with COVID.
Yeah, it is very concerning. You hear a lot of cases of the children they don't even know they've had it, things like that. But, we tend to forget that there are, just because that's the majority, we forget that the minority who shouldn't be marginalized are having some pretty extreme responses to the virus and needing some very invasive medical treatments as well.
So again, a reminder that if any child between the ages of 5 and 11 right now is eligible to be vaccinated, how are we doing in terms of supply? I know that was an issue early on.
Right now, apparently, it's not an issue of supply. IDOH has plenty. We need to have the ability to provide more hours at this point, and we're running into the same staffing issues that many of the other healthcare systems and doctors' offices and things like that are running into as well. That there's a shortage of staffing, of skilled staff that can do these types of things, and we're trying to fill in those spots as quickly as we can.
Fantastic. Anything you want to add? I didn't ask.
I think we've hit on a lot of it. We're moving into, I believe last night was the first night of Hanukkah. We've got Christmas going on. We've got Kwanzaa coming up. We're spending a lot of time with family, especially out of town family. It's a good time to have that conversation if you haven't already about getting vaccinated and making sure that we're having safe gatherings.
Chris Walker, Emergency Preparedness Coordinator with the Health Department. We'll check back with you next week.
Thank you, ma'am.